Hello, my name is Patrick and I'm a researcher working with the NIHR East Midlands. And in this short presentation, I will go over the MedHelp study, including what is required from participating practices and what support is available. As we all know, statins are often prescribed to reduce cardiovascular disease risk. However, quite often patients do not take their statins as prescribed, and this is called statin non-adherence. This can be due to a variety of factors, including forgetfulness or beliefs and worries about clinical need and side effects. Additionally, statins are often not prescribed in those that need, prescribed at lower doses than recommended, or older versions of statins are prescribed despite newer versions being available. The MedHelp study will aim to address these problems with a combination of clinician training and supportive text messages sent to patients. The MedHelp study will recruit a total of 40 practices with a list size of at least 6,000 patients from 3 to 4 regions in England, and cluster randomise them to either intervention or control groups with 20 in each group. Within these practices, patients eligible to be included in the study will be aged 18 to 75, be receiving a statin prescription for at least the last 12 months, and showing clinical signs of statin non-adherence. The intervention will consist of an online module in statin prescribing for healthcare professionals, and eligible patients will be sent regular reminder text messages for 15 months to support them to take their statins more regularly. The healthcare records of the included patients will be extracted by Primus, an external software company based at the University of Nottingham, at 0, 7.5 and 15 months. The primary outcome of the study will be change in low-density lipoprotein cholesterol at 15 months. All practices will be required to sign a data sharing and remote access agreement with the University of Leicester and Primus, and a senior practice staff member will be required to provide informed consent on behalf of the practice. A practice staff member will also be required to facilitate the remote data extractions at 0, 7.5 and 15 months, which will take around 30 minutes each time and require no expertise from the practice staff member. All patient data will be pseudonymized at the point of extraction and handled in line with GDPR regulations at all times. Primus have significant experience of secure and robust data extraction procedures. In practices randomized to the intervention group, all staff with prescribing responsibilities will be invited to complete an online training module around 40 minutes in duration related to statin prescribing and adherence. At least 2 members of staff from each practice will be required to complete this training. Practice staff will also be required to send regular statin adherence text messages to eligible patients using the pre-existing automated text messaging system within their practice. The list of recipients will be provided by Primus, and the text message content and frequency will be provided by the central study team. NHS service support and excess treatment costs have been identified for this study and will be available from the local clinical research network, or CRN, and the CRN will be able to provide support regarding any other study issues. Each practice will also be supported by the study team within the corresponding NIHR Applied Research Collaboration, and support will be available from the central study team regarding the facilitation of remote data extraction. If you are interested in your practice participating in this study or have any questions, please contact us at the email provided here. Thank you very much for your time and interest in the study.